Hello, my name is Esther Shadari, and this is my integrative therapy video for NURU 642. I will be talking about my patient by the name of Caroline. She is a 31-year-old Caucasian female that is in the office today for a weekly therapy session. She has history of self-harming and numerous hospitalization due to suicidal ideation and self-mutilation. She has been diagnosed with major depressive disorder and currently on antidepressants. As stated before, Caroline is a 31-year-old Caucasian female that suffers from very low self-esteem. Her low self-esteem has been lingering on since childhood. According to Caroline, she did not have many friends when growing up. She stated that throughout her elementary and high school education, she was bullied. Per Caroline, she cannot remember ever being picked on the kids team or being invited to any birthday parties. She stated that she was raised by a single mom who was also an alcoholic and that she never also had any time for her. Caroline also indicates that she has never been lucky with men because they end up cheating on her or leaving her for another woman. She is currently working at a very popular retail store, yet she feels unaccomplished. For Caroline, I'll be utilizing the cognitive behavioral therapy, which is the CBT, dialectical behavioral therapy, DBT, and solution focused therapy. CBT is a form of psychotherapy that treats problem and stabilized mood by modifying dysfunctional emotions, behavior, and thoughts. This therapy is appropriate for Caroline because she has underlying issues from childhood that has negatively shaped how she views herself, others, and the world, which is where she acquired her core belief of feeling unwanted. For her core belief, she has a conditional assumption that she's still unmarried and without children because she is unwanted. Based on her conditional assumption, she has some compensatory strategies, such as self-mutilation whenever she gets into a fight with her boyfriend or things go wrong at work. Her self-mutilation helps her to cope with her situation at that time. DBT is a type of therapy designed to help people change pattern of behavior that are not helpful, such as self-harming, suicidal thinking, and substance abuse. Well, Caroline does not have substance abuse issues. The whole point of DBT is to change Caroline's behavioral pattern, which will result to decrease in self-harm, suicidal thinking or ideation. DBT has two components. They have the group DBT and individual DBT. The group teaches 4 modules to patients, which are skills that can be used to help them reduce and eventually eliminate maladaptive behavior. These 4 modules are mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness. The individual therapy portion, which is where I come in as the therapist, is to make sure that Caroline is attending her group because you cannot be successful with DBT without concurrently incorporating both components of the therapy. As the individual therapist, I will discuss issues that may come up during the week. I will go through skills she may need help reinforcing, and I will serve as a phone coach to help her with skills to prevent her from self-harming behavior. Finally, I will be going through her diary card and targeting each entry in a hierarchy order. The hierarchy order includes the dangerous behavior, which are life-threatening behaviors such as self-mutilation. Next will be the therapy interference, and these are behavior that is not harmful to self but interfering with therapy. For example, missing therapy, group therapy, or individual therapy. Next will be quality life, which are behavior that may serve as disturbance to quality of life, such as substance abuse. The next will be solution focus, which is our goal-directed psychotherapy with a collaborative approach. It focuses on the present and future. However, it uses a past to help you understand the client's current behavior. The assumption of Caroline's problem are complex, which include low self-esteem, bullying, single alcoholic mom. However, the solution to her problem does not have to be complex. Bottom line, Caroline is resilient and resourceful. Caroline is capable and wanting to change. As her therapist, I can reinforce with Caroline that talking positively helps one think positively. Caroline reached out for help, which indicates that she's a customer and not a visitor nor a compliant. The technique I will used with Caroline is to help her find exception in to the problem so that she can reach a solution to her problem. This can be done by using the miracle questions such as, if you woke up this morning and everything was how you envisioned it, how would it look like? Next will be to incorporate the scaling question, whereby Caroline is asked on a scale of 1 to 10, when was her problem at its worst and when it was at its best. The main reason for the scaling question is to help Caroline be able to measure her behavior and see that she does have resources and support. Also, by asking her what stops her from going from a point lower or higher on the scale. Following that would be the exception question, which helps Caroline to pinpoint a time when her identified problem is less severe or completely absent. Next will be the coping questions, which helps me as the therapist to identify the resources that Caroline does not think she existed, such as getting up to come to therapy today. These three modalities can be used for one patient because a patient may come in with a particular diagnosis such as depression, but have other underlying issues such as anxiety. And evidence has shown that one therapy works better for an individual than the other. I will be starting with the CBT because it gives me depth understanding of how Caroline developed into her present state and what has shaped her core belief. The next I will be using is DBT because she is self-harming, and self-harming has been linked to suicide, and I can help prevent that from happening. I'll also be using next will be the solution focus because to help her realize that she is resourceful, resilient, and there's a positive future for her. My expectation is that Caroline will be very honest with me and follow the guidelines that I have established for her. Caroline will be diligent in completing all her assignments that's given to her during the therapy. Most importantly, I hope to develop a positive alliance with Caroline. I believe that the approaches I have chosen do not impose on Caroline's cultural belief. However, if they do, I will make sure to check my biases and find another approach that will be more suitable for Caroline and discuss it with her to make sure we can incorporate her cultural belief as it is permitted within the therapy. All of this chosen therapy are evidence-based, and all three have shown to work effectively on the symptoms that Caroline is exhibiting at this time. Coming up next, I will be evaluating Caroline using the therapy's approach that I have discussed, starting with CBT, followed by DBT, and finally solution focus. Hello, Miss Caroline. How are you today?
I'm good.
All right, good. Do you give me the consent to do this recording?
Yes.
Good. All right, so let's start our session. How are you feeling today on the scale of 0 to 10, 0 being the worst and 10 being the greatest, since the last time we met?
Well, currently I feel like I'm about an 85%. Maybe sometime I was like a 60, but mostly 80.
Okay. All right. So can you tell me what was useful from our last session?
When we talk about my thoughts and how to better manage it, I was able to challenge my irrational thoughts last week.
Oh, okay, that's very good to hear. Good. As you know, at every session, we set up an agenda. What would you like to work on or for us to cover today? And remember, so that we do not go over, we have to prioritize them in order that is the most important to you.
Even though I haven't cut this week, I am still having some strong urges to cut, and it's really driving me really nuts. Like, for example, at work, my boss made a correction on my paperwork, and that made me feel really stupid. Also, I called my boyfriend twice yesterday, and it took him like 5 hours to call me back, which made me very upset.
Oh, sorry to hear that. But in the meantime, let us review your homework from last week, which closely relate to one of your agenda today in regards to your boyfriend. When he did not return your call right away, were you able to write down your automatic thoughts? Were you able to find evidence against for your automatic thoughts?
It was difficult at first. I thought he was with another woman. He is going to leave me. These were the thoughts that were going through my mind. He does not love me. I am a failure in relationship.
Were you able to challenge these thoughts?
Yes, I was able to, but it took a long time.
Remember that you said you were feeling stressed, going nuts. So you mentioned that you were having the urge to cut. Can you talk more about it?
When I was calling and he didn't call me right back, also when my boss was bothering me, the whole thing felt overwhelming. I am glad that I didn't cut, but I had really serious urges too.
All right, that is really, really good. I'm proud of you. During this week, Caroline, whenever you're having the urge to cut, write down your automatic thoughts, and so we can track your thought during our next session. How does that sound to you?
That sounds good.
Do you have any questions for me today?
No, I don't.
All right, thank you. Okay, Caroline, now that you've completed our mindfulness, how are you? I want to check in with you and see how the DBT skill training group went.
It went well. I went to it. I've been going every week, so it was nothing different.
Okay, that sounds good. So, let's review your diary card today. Can I have your card, please?
Here I go.
Oh, good. Okay. I see that you've been taking your medication as prescribed.
Mm-hmm.
That's very good. I also see that you have days where you did not self-harm or have suicidal ideations.
Mm-hmm.
That's very good. However, on Tuesday, it looks like around 8 p.m. you try to self-harm.
Yeah, I did self-harm on Tuesday at 8.
Okay. Do you mind telling me more about what happened on Tuesday?
Well, what happened is that someone at work commented on my job, and I called my boyfriend, and he didn't pick up the phone. He never does. Anyway, when I got home, I tried to follow some of the DBT skills. The skill accept, right?
Mm-hmm. Mm-hmm.
Well, I tried to do that one first. I started doing the activity, contribute, then I tried to do the comparison, from myself to somebody else.
Okay.
Then I tried to do the emotion push away, my emotions, what I'm feeling, to accept my emotions. Then I try to push away the thoughts, and then I try to do the mindfulness, like the sensation, like what we did just now, one of the
Okay.
mindfulness. I try to
Mm-hmm.
do that. However, it didn't work, and I kind of tried to do another skill, but that didn't work either. So I picked up the phone and called my boyfriend again. Obviously, he didn't pick up or call me back. So eventually, I went to the bathroom, and I know I saw a razor that I thought I had thrown away,
Okay.
but so I began to cut.
Do you remember the other skill that you tried to use beside accept that did not work?
Yeah, I try to use the one with the whole emotion regulation. I try to use like what's that one where I try to use mindfulness. So I did that. I try to
Okay.
do other mindfulness, but no, that did not work.
Okay, that's fine. All right. So remember that whenever something like this happen, a life-threatening behavior, we have to always go through our chain analysis.
Hmm.
You tried your skill and it didn't work. What do you think you could have done instead of cutting?
Well, after we've gone through like the whole step on the chain analysis, I now can see that number one, I know I could have called you so you could coach me. So I could have called you so you could coach me to practice the skills. Maybe
Okay.
like you could have told me some other skills that I didn't think of at that time that would have prevented me from self harming. So yeah, and I probably could have stopped that when I picked up the right before I picked up the razor. It looked like from the chain analysis, that's what I could have done before I
All
picked up the razor.
All right, it's good. So I'm very happy to hear that. Okay, so what I want you to do, Caroline, is I want you to continue to record on your diary card. I want you to continue to attend your DBT skill group.
Hmm.
And always, please, always remember to call me to practice your skill whenever you feel like self-harming. Okay?
Okay.
That sounds like a good plan?
Yes, that sounds
All
a good
right,
plan.
good.
Thank you. When you told me that you wasn't gonna do it.
Hello, Caroline. How are you today, and what brought you in here today?
Well, I, just got out of inpatient. I'm still feeling depressed. I still keep having thoughts of hurting myself, and some of the reasons why. I think my boyfriend is cheating, and work, like always, is very stressful for me right now.
Okay, so we're going to try this, Caroline. I'm going to ask you a rather strange question.
Mm-hmm.
After we talk today, you will go home, you will take a shower, eat your dinner,
Mm-hmm.
go to sleep, and in the middle of the night, a miracle will happen. All this problem that you came in today, your boyfriend not picking up, self-mutilating, your mom, every problem will disappear. They will be solved. However, because you were sleeping, you didn't know that this miracle had occurred. So, when you wake up tomorrow morning, what would make you believe that something actually changed in your life?
Hmm. Interesting. I guess my alarm clock would go off. And, I'm tend to keep tapping it all the time, so I would get up right away. I guess I would have a smile on my face. When I call my boyfriend, he would pick up on the first ring. And while I was at work, he would be sending me like smile faces, I love you type of things.
Mm-hmm.
And then at work, my coworkers who doesn't normally say hi to me, even if they don't say hi to me, I would not feel that I'm not unwanted.
Oh, that's really good to hear. Good, we're progressing. So, on a scale of 0 to 10, what's the worst your problem has ever been?
Well, I would have to say a 9.
Okay.
Obviously, because that's when I was in inpatient after my boyfriend left me, and I started cutting myself, and I was there.
So, what makes you think it was a 9 and not a 10?
Well, I guess a 10 would mean that I would be dead, right? I wouldn't be here.
Okay.
So I guess the 9 was because I went to inpatient, I got the help, and like I told you, I guess I didn't kill myself.
All right, that's good. We're doing very well, Caroline. So, let's try this. Think of a day when you were lower than a 9. What was going on?
Lower than a 9. Hmm. A day lower than a 9, I would say that on that day, probably the day I was in inpatient, my boyfriend came to visit me in the hospital. And then, oh yeah, when I returned to work, people was actually happy to see me.
Okay.
I think maybe a 4. I was a 4.
Okay. Um, That's very good. So let's think about this. On an everyday living, like this is a perfect world, everything is great. What would you say would be a good number for you for like every day?
I would hope a 3. I'm not gonna say a 1 because not no one's perfect. So I would say a 3 because at that time I would not be cutting, and even if my boyfriend or somebody at work upset me, I don't think I would be cutting because of that.
Okay. So tell me a time when you did not self-harm, even things were not going well for you, like, your boyfriend is not calling you back or things are not going well at work.
Hmm. I'll give an example of my boyfriend. Probably like a year ago, or maybe. Anyway, we were supposed to be going out. He didn't, call me back. He didn't pick up. So I ended up calling a friend of mine. We were talking, and when he called me back, he was telling me that he had car problem. But normally, even before he called back, I would already start cutting. So yeah, so I was able to. I guess I was able to call somebody else to kind
Oh,
of help me.
that's really good. I can see that things have been very, very difficult for you. And you were just recently discharged from inpatient for self-harming.
Hmm.
But I still find it very amazing that you came in here today very open and willing to tell me all your problem. How did you do that?
That's an interesting way of looking at it. I guess I would have to say maybe I am that way if I can think about it. Even when my mom was annoying, drinking, one thing she could always depend on is that I could bounce back. I guess I am.
That's
Thanks.
really good. You know what, Caroline? You've done very well today. We'll stop here, and next, when you return, we'll be discussing some other exception questions and other talking about more coping mechanism with for you. How does that sound?
That sounds good.
All right, thank you.